Welcome, I'm so glad you all could join me. I'm Chavah and you're watching Ask a Midwife. Hi everyone, I'm Chavah and this is the Ask a Midwife channel. Today we're going to be discussing tools for communicating with your care provider. These tools have served me as a pregnant woman, as a patient, as a client, as a doula, and as a midwife. If I have to communicate with the doctors in the hospital regarding a client, these tools are useful to me. I repeatedly find in my practice that when I teach women these tools, their experiences with their care providers are more productive, less intimidating, they don't feel as vulnerable, and they feel more confident. So I'd like to share them with you. We all agree that being a pregnant woman is a pretty vulnerable experience. There are things that you can't control. Sometimes the feeling of being out of control can play on our vulnerabilities, and we feel a little bit intimidated sometimes, especially when we come face to face with the care provider, especially if we're concerned that the care provider is going to make a recommendation that goes against our wishes. I speak with women on a regular basis who are in contact with me, and they often need support and encouragement, and they need tools to communicate with their care provider. I'm always faced with how to help these women, and so I've decided to make this video in hopes that you'll watch it and you'll say, oh, okay, that's going to be how I'll come across to my doctor. Sometimes we've had bad experiences with doctors or other medical care providers, and that can really play on our fears, especially when you're going into a similar situation. Let's say there's a woman and she's had a really bad negative experience in a previous birth, and then for this birth she chooses a new care provider and she's having a hard time feeling like she can trust that person, that she feels safe in that person's care. And it doesn't really have anything to do with the way that person's caring, the way that provider is caring for her. It has more to do with her, her trauma. So don't underestimate yourselves when it comes to past experiences, how they influence these current experiences. I'm going to talk about how we can overcome those things too, to the best of our abilities. Emotions are running hot in the end of the pregnancy, and it's so easy to get triggered. Like, what I mean by triggered is that our emotions, suddenly we're just flooded emotionally, and that can happen at any time, especially when you're dealing with, going to your doctor and hearing things that you don't want to hear and having discussions that are not so comfortable, and that can really trigger us. So my best advice to you is, first of all, try to give yourself time and space to feel the emotions, but don't make emotional decisions when you're trying to get the answers that you need. So really try to keep fear and emotional reactions to a minimum. We can do this by giving ourselves self-talk, telling ourselves that, yes, I feel this way, but I'm going to make a good decision for myself and my baby, so let's get information. So that the tools that I'm going to teach you are techniques for getting information from your doctor and getting to the bottom of what's really going on so that you can make the decision. The way that it should work with your doctor is, your doctor has the tools and skills to assess the well-being of your baby and assess your well-being. Meaning, is your blood pressure okay? Is your amniotic fluid okay? Are you having any other, pregnancy complications? How's the baby? Is the growth okay? Most of the things that the doctor can do for us are relatively objective. What I mean is, there's his opinion about things, which is sort of subjective, and then there's the objective, the objective facts that he gets from blood tests. You got a blood test and you had a hemoglobin of 10. You had a blood test and your platelets were under 100. This could predispose you to a hemorrhage. So we have to make decisions about what might be the best plan of action for someone who might be at a risk for a hemorrhage. Or your water level is 30, which is, much, much higher than the average water level, which could predispose you to having, whatever complications. Placental abruption, things like that. So we need to use the doctor-patient relationship, the client care-provider relationship to have good communication and informative discussions about the complications themselves. And for that, you need to do a little bit of homework on your own before you meet with the doctor. I want to remind you, if neither the mother or the baby are in imminent danger, it's not an emergency, and you do have the time and space, and you should definitely take the time and space to inform yourself. So let's say you go in and you have a discussion with your doctor and some concerns are brought to light and he makes a recommendation. You take some notes, you get out your phone, you get out your recorder, you can tape a conversation to be able to play it back to yourself and maybe play it for your partner as well so he can hear the information that was given over by the doctor. Sometimes we get so flooded, I can't believe what I'm hearing, I'm so emotional, and you sort of forget what was said. And it's really, really important to keep your head on because your baby needs you. So get the information, take notes, take a recording, write some notes down, or have the doctor write notes down. You can also ask him to, can you write the name of that complication down for me? Thanks, I'm going to look it up. It's harder for a doctor. I want to validate the doctor's experience and that it's harder for a care provider. It's more challenging often for a care provider to give care to a woman who is informed. It doesn't really say anything bad about the doctor. It's just that for the most part, you have to understand that many, many women do not take it upon themselves to get informed, to inform themselves. And so what you've got is a doctor trying to make the best decision for the baby and the best decision for the mother. And most often, the woman herself doesn't really have the information to have an informed intellectual conversation about the problem. And so therefore, you basically have the bottom line. You have, this is going on and this is what I recommend. So it's almost like when the doctor encounters a client who has questions, who wants to know, who's writing stuff down, who's asking, informed questions about the problem. At first, it might be like, whoa, and the doctor might get a little triggered, like a little defensive, or what, you don't respect my authority, or what, you don't think I'm telling you the truth. Whatever it is, work through it with the doctor. The doctor is a human being. The midwife, we'll just call it care provider. The care provider is a human, and they have all the faults and emotions and feelings of a human. So we've got to work together with that. Okay, and we can. Basically, you're going to take notes. You're going to ask informed questions. If you think you know what the discussion is going to be about, and this can be true in a private meeting with your care provider or upon going to the hospital and meeting with a care provider at the hospital. Here in Israel, we have the doctor that cares for the woman in pregnancy. If she has a private midwife, then she's using that midwife to care for her in pregnancy. And then in the hospital, we have a whole other set of care providers who manage the end of pregnancy issues as well as the labor and birth process. So when I say that this could apply to a private meeting with a doctor or a meeting in the hospital with a doctor, is you arrive at the hospital here in Israel and you sort of have to establish a relationship with one of the doctors there, whoever's on staff. Either way, whether it's in North America or whether it's in Israel or any other country in the world, generally it's beneficial to bear in mind that the doctor is really working for you. So often, doctors seem rushed. We feel vulnerable. We ask questions. Maybe they don't give us sort of social cues like, oh, I'm sitting down with you. I'm getting comfortable. Maybe I'm turning my phone over. I'm really listening to you. Those body cues tell us that it's okay to have our questions, that it's okay to express our concerns. When the doctor is standing there rigid, he's looking at his watch, he's sighing, maybe he's impatient, maybe it has nothing to do with you at all, but he's got someone in the next room who really, really needs him. Either way, those cues, those body language cues are interpreted as, oh, I don't have permission to have my questions, he's not going to give me the time, I feel pressured, and then we forget what we want to say, and then we feel bad that we didn't advocate for ourselves, or we look back on the meeting later in the day and think, why didn't I ask that? It went out of my mind. So what I encourage you to do, and this is really, really important throughout your pregnancy, as well as in the actual, maybe checking into the hospital, the birth itself, whatever it is that you, before you actually have the discussion with the doctor, you say, do you have time for me right now? Because I need a few minutes of your time just focused on discussing and and thank you for your patience as we move together through the information, or whatever your own words. You can formulate that in your own words. Maybe you could say something to the effect of, I need some time. Please be patient with me as we discuss these options. Or, I appreciate your patience, or I appreciate your support. It really helps the doctor, even if you don't feel this way, to give him sort of a positive kudos or a positive compliment, even if he hasn't really fulfilled the things that you're complimenting him on, or her. Say like, thank you so much for your, thank you so much for your time. Thank you so much for caring. I really appreciate your support. And it helps me so much when we can just sit down and discuss some of the questions that I've been having, because I've been waiting a long time for this appointment, so I'm hoping that you really have some time for me. Okay, what will that do? First of all, it'll give you a chance to really say what you need. When you ask for what you need from someone who's in a position of giving you what you need, like your husband or a parent or your child or a provider, a care provider, when you sit down and you say, this is what I need, first of all, you have to get straight with yourself. It's okay to need these things. It's okay to feel confident about the fact that you have some questions, okay? And you've done a little research ahead of time, so you understand like kind of what you want to talk about. I'm a big proponent of researching information about your health, about your situation, about different aspects of what you're experiencing before you have the conversation with the doctor. Sometimes you're in a situation where, whoa, it just kind of hits you. Suddenly you're having a conversation, you're not really prepared for it. And then you can still use this formula, which is essentially requesting time and space from the doctor, expressing appreciation for the doctor being so caring and so kind and so patient, even if he's standing at the door looking at his watch. You can be honest with the doctor. He's just a person. I'm saying he, but because I'm imagining this guy standing by the door, but really it could be anyone. It could be a woman, it could be a man. I see you're really rushed right now. For me, I just need a little bit of time. So is this a good time? Do you want me to do you want me to wait until you look like you have somewhere to go? Do you want me to wait here while you go do that? And I just need a little bit of time where we sit and we talk about what to do, because I have some questions. You have to draw on some confidence, even if you don't really feel the confidence, okay? You have to remember that it's okay to feel intimidated, it's okay to feel afraid, but if you know how to take care of getting your needs met, there's a lot less reason to feel afraid and intimidated, because have confidence in the appropriateness of asking questions from your care provider. Does that make sense? I hope so. So after you make it clear that you need the time, and hopefully ideally what you'll get is some positive feedback. Well, sure. Or, no, I don't really have time for you right now, is actually kind of good to know, because then you can stop the conversation right there, because you cannot have a good conversation with your care provider if they're saying, I don't have time. That's it right there. If you don't have time to talk to me about what's going on with me, then we'll need to make another appointment. I'm happy to come back. When do you have more time to talk with me? Maybe you need to schedule a little bit more time, because I really need this from you. Okay? But generally what you'll get is, sure, I have time right now. Or, yeah, I have about 10 minutes until my next patient. Or, I'm right in the middle of something, let me come back. Or you'll get some positive feedback. But once your care provider knows that you need time, hopefully, and this is what I've experienced, is that the energy is going to shift. You'll get a sort of a permission to be heard. So when you do have this conversation, it's really important to understand how to ask questions. You need to be able to ask specific, pointed, direct questions with an intent to get the bottom line, which is, how is the baby doing right now? How is the welfare of the baby right now? How is my welfare right now? How is my health? But be confident. Ask. Rather than saying, well, is my baby okay? I mean, I'm really worried about my baby. I really want my baby to be okay. Is my baby okay? Say, do you see that my baby's doing okay? You see my baby, do you see my baby? Do you see anything concerning about the baby right now? Do you see anything abnormal? Can you explain to me what you see that's abnormal? You have to ask specific questions about the welfare of the baby and specific questions about your own welfare. If he says, well, your blood pressure is running a little high, okay, well, what is my blood pressure right now? And what is considered high? And what are the risks? And what could that mean? And you're going to probably, at some point, it's possible that you might even annoy the doctor, because the doctor is someone who already knows all this information, and you're just sort of figuring it out for the first time. And that could be a little irritating, but don't get put off by that, okay? Because you have to understand, doctor's a person too. We all have levels of patience. I find that there are, and this is kind of an interesting thing, I find that there are many different ways to ask the same question. And those different ways will elicit different responses. We can ask with, if we ask questions in an emotional way, we're not always going to get the best answers. That's why I'm saying, even though pregnancy is an emotional time, tell yourself, I'm going to deal with the emotions later. Right now, I'm working for the baby. We're the very most important thing to our baby, and that in particular, what we can do for our baby prenatally. We can ask questions. It's not the time to get emotional. I know that sounds so terribly, I know that sounds so terribly unfeeling as a midwife. We're working with all kinds of pregnant women. It's really true. You've got to take your emotions out of it. So aside from taking notes, asking informed questions with the intent of getting specific answers, you can also bring a support person to your visits. Bring a doula, bring your husband, bring a friend, bring someone. If you feel more confident in the presence of a third party, bring that person. It's okay. Also, sometimes you might want to have a conversation with that person ahead of time about what is it that you want to get out of the visit. Your doctor has been making noises for the last month about possibly inducing you after 40 weeks, and here you are at 40 weeks and you're going in and you're talking about options with your doctor and you're feeling intimidated. You're not feeling as confident as you thought you would. Bring your friend. Have a conversation ahead of time. Bring your doula. Do some research online. Find out statistically a normal, healthy pregnant woman carrying her first baby, average pregnancy length is 41 weeks. Find out about how flexible the doctor is. Questions like, is the baby reactive? How's the baby look on the monitor? Do you see any reason to be concerned about my baby's welfare right now? How about my welfare? How's the amniotic fluid level? Don't accept answers like, it's low. Ask, how low? What's the range? Things like, how accurate is the assessment? The estimated size is 4 kilos. What's the range of accuracy for an ultrasound at full term? You say, my baby looks like he's 4 kilos. What's the range of accuracy? Could my baby be less? Could my baby be more? Another really important thing to ask your doctor is, are you willing to support me if my decisions are different than you recommend? That's really an important thing, because if the doctor says no, then you know that you really need some serious help there. That's a question to ask him or her earlier on in the pregnancy. You can ask him. You could ask your care provider. You could say, I had a previous experience that wasn't so great with my care provider, and I need to know that you'll support me in my decisions if what I decide is possibly even contrary to your opinion or your recommendation. Are you still willing to support me? If you want to express to your doctor how you feel about something, what you think about something, and you'd like to wait on his advice, let's say the advice is to induce, and you'd like to not. You say, I prefer to wait. Thank you so much for your help. I really appreciate all your caring. You've explained that there's a risk, but you've explained that right now the baby looks okay and that I'm healthy, and I'd like to go home and do natural methods of induction, and I'm willing to come back. What do you recommend? 3-4 days? Okay, I'm willing to do that. Show that you're willing. Show that you're reasonable. When a doctor senses that a patient is being unreasonable, that they're attaching themselves to an outcome or to a decision that they won't budge from, that even if you feel that way inside, like there is no way that I will ever have an epidural, it's not a very wise idea to advertise that you feel that way. Don't come across as unreasonable to your doctor, because that will create like a shutdown mechanism for your doctor. Your doctor will sort of view you as like, forget about it. She's unreasonable, so I don't even want to deal with it. But you can say things like, I prefer to wait. Do you see anything that gives you the idea that there is a problem right now? No, but if you wait, statistically, there are more problems if you wait. But everything looks okay right now, correct? And, say it with confidence. You can say things like, I prefer to wait. I'm willing to ... I'm willing to come back for a monitor in a few days. I'm willing to come in if I don't feel movement. I'm willing to do more kick counts. I'm willing to take my blood pressure twice a day and message you the results. Show you're willing, show that you're flexible, show that you're reasonable, but come across as strong and confident. So how do you respond when your doctor advises you to do something that you at first, think, I don't think I want to do that? First, you have to act reasonable. You have to be strong. You have to show confidence. You have to show that you need more information, that you need him to be patient with you, that you need for there to be a space for interaction and for dialogue, for asking questions. You need to know the risks of doing the intervention. You need to know the risks of not. You need to know the concrete things that the doctor sees that leads him to believe that there's an issue. One of the most important things to assess is if it's urgent. You could be so deeply concerned that there's a problem that you get scared. Okay? Now that fear will automatically, it will cloud your thinking, it will cloud your ability to have a good dialogue. So really try hard to assess, first and foremost, is there an emergency right now? Do you see anything that leads you to believe that there's an emergency right now? You need to keep asking questions until you have enough information to make a decision, and you need to weigh the benefits, weigh the pros, weigh the cons, weigh the dangers, and really make some informed decisions. Your doctor has a lot of information. He has a lot of education, he has a lot of experience, and he has access to specific information about you, your blood work, your tests, and your history. Okay, and those things he's going to take into account, and he's going to look at protocols and standards of care, etc., etc., also rules for the hospital, and he's going to make a recommendation. Nobody can take you and force you to have an induction, but there are more than one way of forcing someone into a situation that they don't really want to be in. If you really feel in your heart that the baby's okay, and there isn't anything conclusive to show you that the baby's not okay, and the doctor is saying, we really recommend an induction, and you're feeling like, if I say no, he's not going to give me good care, he's not going to support me, he's going to be, it sounds terrible to say this, but he's going to be mad at me, he's going to be, disappointed, and we have all those, or my husband's going to hear that the doctor's afraid, and that my husband's not going to support me, and I'm going to be pressured into inducing labor early on account of, my partner, how my partner feels about things. My partner is triggered. It's really, really an emotional time when you've got a baby in your body and you're not really sure what the right thing is to do. If you use these tools, you're not necessarily going to be 100% sure that you're making the right decision. You stand a chance of making a decision that you feel good about. Making a decision that's based on information, that's based on you being empowered by the support of your doctor, by the support of your partner, by the support of your doula, and an inner knowledge that you're making the right decision for you based on all the facts. You might have 20 factors, okay, including your mother's leaving town and you really want to have the baby before she leaves, and you carried to 42 weeks last time, and you might have so many factors. You just have to take all the information in and then make a good decision. In the end of the day, you're the one making the decision, and if you can come to the table, okay, with your care provider and feel like, I'm a confident, informed woman doing the very best that I can express my needs, I can be honest, I can communicate clearly, I can express appreciation to my doctor for the good care that he gives me, I can advocate for myself, I can advocate for my baby, I can say no to something that isn't for me, and I can say what I prefer. And this is really not an easy thing for a lot of women, and especially compounded by the vulnerability that we feel in pregnancy. It's like, I don't know, I just want to crawl in my bed and put the covers over my head and wake up and be in labor and not have to deal with this and not have to think about it and not have to make a decision, and it's so hard. It's also really good. It's a really good, it's a good process to go through, because really at the end of the day, when you have your baby, you're not done. You've begun the process of raising your child, and that takes a lot of confidence. That takes a lot of resilience. That takes a lot of communication, whether it be with your child's doctor or your child's teacher or your child's father or your child's, anything in your life, anything having to do with your child, you're the parent, you're advocating for the child, your child's source of the well-being that your child enjoys in life really comes directly from the parent in the young years. So this is practice, okay? And if you have a hard time making decisions, and if you're not confident in what you know, that's a good cue for you to be able to exercise those muscles, so to speak. So I wish you all confident communication with your doctor, your care provider, your midwife, your confident communication with your partner, with all the other family members, all the individual people in your life that you need to practice these skills with. I just wish you a lot of success, and just remember, it's okay to take a breath when you're communicating. It's okay to pause and consider what you want to say, and we have to believe that other people in our life want to hear what we have to say, are interested in our concerns, would like to basically help us, and that our care providers really want the best for us, and that we also have to believe that our care providers would like us to be satisfied with their care. There's a misconception that doctors don't care if you're satisfied, and that is not true, okay? So when you have an interaction with your doctor, you can set the standard of care with your doctor from the beginning. When you go in there and you tell him all the things you appreciate in a doctor, he wants to be that doctor for you. And if he doesn't, then he's all washed up and you need to choose a different provider. I realize that there are women who don't have a choice, and I realize that there are women who, based on where they live, based on their insurance, based on their coverage, based on their needs, based on their history and their risk level, that they have really limited choice of the care provider, and often a really limited choice of the hospital or the birthplace that they have access to. So you really have to do your best, and there isn't a magic fix for these situations, but I can just tell you from 20 years of what I've seen is women getting psyched out. They get overwhelmed, they get scared, they get emotional, they feel intimidated and threatened by the doctor, they feel like they don't have any choices, they feel like they're unprepared, they feel like they don't have the autonomy to make good decisions based on real information, and they don't want to let the provider down. No one wants to put their baby at risk, and when we hear your baby might die, when we hear there might be a horrible problem with your baby, if you don't do what we're saying, then these horrible things could happen. That's, in a way, it's almost like they intend to elicit that reaction. Recently I was reading something that someone had written online, and they were saying something to the extent of, the main times that women hear those threats, like, if you don't do this, your baby is going to, be damaged, or your baby's going to be in risk, and if you don't do these things, then your baby's going to be in grave danger. A lot of the times that women are told these things is when they're being strongly encouraged to submit to these kinds of interventions. On the flip side, when things really are going wrong with the baby, and there is a problem, and there is a baby who's suffering, in trouble, at risk, more often than not, the providers are much more compassionate. It's odd, it's ironic. They're using the emotional triggers of the woman to get her to comply, and that is really unfair. And you can call doctors on that. Say, I really appreciate your concern. You could say, I really appreciate that you're trying to help me understand the risks, but being scared into a decision is not responsible. Okay, please don't try to scare me into a decision. I need concrete information, and I really appreciate it. I appreciate that you're there for me. I appreciate your time. I'm sure you sense a theme in what I'm saying, and I'm sure you hear me kind of repeating the same ideas over and over again. So I really hope that you've absorbed some of these ideas, and that you can take these ideas and think about them. And the first step, I think, would be to create an awareness with the way that you communicate. How do you feel when you're sitting in your doctor's office or when you're face-to-face with your care provider? How do you feel when you have to call them on the phone? How do you feel? What is your emotional reaction? Do you feel reassured? Do you feel like he's giving you the time? Do you feel like you're being supported? That's the first step, is just understanding your own reactions, and then understanding how you, like, getting a little bit of perspective on how you sound when you communicate. The way that you communicate will determine the responses that you get. Most doctors want the best for us, and when we demonstrate that we're confident and that we're strong and that we're reasonable and that we're informed, we often get the best results that we can, and you're going to find a lot of success. So hopefully the things that I've taught you today can be utilized and implemented, and I'd love to hear what you think about what I've said, and if it's worked for you, or if you have any additional questions, or possibly there's something I've missed and you want to add it, would you please comment down below and like this video. And if you want to share it with someone that you know in your life who's having a hard time, if you think that they might benefit from the things that I've discussed, I would really appreciate it if you would share it as well. So I wish you a wonderful birth and a positive experience and a good, productive relationship with your care provider, and I hope you join me next time.